Hello everyone, welcome to ITLS Academy. This is your mentor Dr. Shamaita Basu, and in this session we will be starting with the topic toxicology in the crime laboratory. So in this session we will be mainly focusing on part 1 of this topic, since again this is a very broad topic and I want to talk about in details about this topic. Okay. So, starting with the topic of toxicology in the crime laboratory, I would firstly like to give you a brief introduction about what is actually toxicology. Okay, so toxicology can be defined as the study of the adverse effects of chemicals or physical agents on the living organisms. So, the word toxicology basically derives or arrives from the term toxic. Okay, toxic or toxicity. So anything which is toxic, it can be a physical agent, it can be a chemical agent. Toxic means it is producing some adverse effects, it is producing some adverse symptoms inside the living system, inside the body of the living organism. So that is what is actually toxicity. Okay, so toxicology will be basically the study of those various adverse effects or the study of those toxic effects inside the living body. Okay, now there are various types of toxicological agents or toxicological studies or perspectives. Okay, what are they? So firstly will be the environmental toxicology, which will obviously include the environment. And by environment what we mainly mean is water, air and soil. These are the three main elements that form our environment or surrounding, isn't it? Next what we have is the consumer products or the consumer section. Okay, so in the consumer aspect, what all things will come in? Anything that we are consuming. Okay, so it does not necessarily mean only the food items, only the food particles, but also the different cosmetics and the different drugs. Okay, drugs as in both medicated drugs as well as the abusive drugs. Okay, both will be included in that. And cosmetics means all the various, the creams, the powders, the shampoos, the deodorants, everything that we put on our body, that we apply topically. Okay, and food is something which we are ingesting internally. Okay, so all these will come under the consumer wing. Okay, and other types that we have is medical toxicology, clinical toxicology and forensic toxicology. So here, since it is a a topic or a section of the module of forensic toxicology, so obviously, sorry, forensic techniques, so obviously we will be focusing on the toxicology with respect to forensic science. Okay, so moving forward, so what will be basically the role of the toxicologists as part of the forensic science? Okay, or with respect to forensic science charges. Okay, so they will be charged, the toxicologists will be charged with the responsibility for detecting and identifying the presence of drugs and poisons in the body fluids, tissues and organs. Means any particular agent or any particular chemical, or it can be any physical agent also, which will be responsible for producing the different toxic effects, okay, inside the body of the suspected individual, or it can be inside the body of the victim also. Okay, so mainly it's in the form of drug or poison, and that is the job of the toxicologist, to find that agent, to detect it, to identify it, to measure it. Okay, which will be helpful in the course of the investigation. Okay, so the toxicologists not only work in crime laboratories and medical examiners' offices, but may also reach into hospital laboratories and health facilities to identify a drug overdose or monitor the intake of drugs. So this entire concept of drug overdose, drug abuse, whether the victim was forced to take any drug, whether the victim was poisoned with any drug, all these findings actually need association with a health clinic or a hospital. Okay, so that will also be an integral part of the job of the toxicologist, to go and visit the various hospitals, to talk with the doctors, to work in collaboration with the doctors and the nurses and the various healthcare personnel. Okay, Okay, so again, as I always say, ki whenever we are talking or whenever we are learning any new topic, it's very important that we have a very fair amount of idea about the history, how that topic, how that subject at least originated. Okay, so here also in case of toxicology, it's the same thing. So I would just like to give you a brief idea about the history of toxicology, where I will mainly talk about the father of toxicology. The image of that person is given over here, as you can see. So he is known as Matthew Orfilia. Okay, so what he did, he was conferred with the title of father of toxicology in the early 1800s. So his work mainly centered around arsenic. So arsenic, we all know it is a toxic heavy metalloid, and it is known to produce various toxicological effects, various adverse effects inside the living system, which include neurotoxicity, gastrointestinal toxicity. Okay, it can moreover it is famous for causing skin cancer. Okay, various skin eruption related with cancer outbreaks. So it was relatively easy to get because it was the rat poison of the day and was the favorite murder weapon among the poor people. So arsenic is a main constituent which is present in the rat poison. Okay, and in those days, during that period, during the early 1800s, it was a very favorite as in it was a very easily available, cost effective. Okay, publicly accessible. Okay, so the all these points actually make it a favorable murder weapon, particularly among the poor people, because they are poor. They cannot afford to buy a gun or maybe a rifle or a pistol. Okay, so rat poison is something which is available in the market at a very low price till now. So in those days, in those early days, it was very common among the poor people for use as a murder weapon. Okay, now what is the various, the specific difference between intoxicant and poison? Okay, when will you call it an intoxicant and when will you call it a poison? So an intoxicant is, for example, alcohol. A nice example will be alcohol. I've given figure also over here. It requires that a relatively large amount be added to be lethal. So basically the basic difference is कि if it's a poison, that means a very small amount also will be lethal or will be fatal. Lethal or fatal means it will be potent to kill a particular person, a particular living being. Okay, say for example poison over here I have given the example is arsenious acid, means basically arsenic. So it's a poison. Okay, but intoxicant means it can also act as a poison, but means it can also be lethal or fatal, but only if it is given at a higher dose. Okay, only if it is taken at a very high level, then only it will be able to have some lethal effect or fatal effect. But poison means even if I give only this much of amount, only say 5 microliter or 2 microliter of amount, that will be enough to kill that particular person whom I am targeting to kill. Okay, so that is the basic difference. Now coming to the main field of our interest, the main topic of our interest in this session, that is forensic toxicology. So it is found in what all different sectors or fields. So number one will be postmortem, which will be done by the medical examiner or the coroner. Second will be the criminal, okay, which is mainly associated with motor vehicle accidents, which I also call as RTA or road traffic accidents. It can be found in the workplace, where we have to go for drug testing. It can happen in sports field also with humans and animals, because in sports field what happens, particularly in case of humans, the various sports person, they usually take steroids, okay, to have more strength and stamina while they are playing in the ground. So those steroids, if a person don't have an idea about the exact dose or the proper dose, and if that person overdoses himself or herself with that steroid, then that will also come under toxicology. Okay, and if that person by chance dies, okay, then obviously the family members or the partners, they will not want to accept in the first place that it has been accidental death. It has been due to due to low knowledge. The person didn't know the actual dose of the steroid. They will obviously say that my son or my husband or my wife, whatever it is, he or she has been killed. So they will ask for a study, a probe. So in that case, the FIR or the report that will be generated will be that of an unnatural death. So automatically, if the FIR or if the report is that of an unnatural death, then automatically it will come under the section of forensic science. Okay, so there comes the role of forensic toxicology. Okay, and talking about environment, it will include various industrial factors, catastrophic factors, and terrorism, obviously. Okay. Okay, now these toxic substances, they may be a cause of death, they may contribute to death, they may cause impairment, and they can also explain behavior. Okay, say for example, if a person is alcoholic, he or she is regularly taking alcohol on a regular basis. Alcoholic means that person is taking alcohol on a regular basis, daily basis. So immediately that person will not die. Maybe in the long term that person may suffer from various terminal illnesses and that person may die. But initially what will happen? There will be changes in the behavior. So that will also be a role or a function of toxic substances in our body. Impairment means it may happen that due to alcoholism, due to extreme alcohol consumption, okay, necrosis has happened in some part of the body. As a result, the hand or the leg, maybe it has to be amputated. Okay, these things happen, these things are common. So that will come under, that will fall under the section of causing impairment. Okay, then contribute to death means directly the toxic substance maybe is not causing the death of that person, but indirectly it is contributing to the future death of that person. Okay. Okay, so I have just given example of a very common and very well known toxic substance. I am sure that all of you must have heard of this substance, that is carbon monoxide or CO. Okay, so basically it is an invisible chemical, invisible gas. It has no smell, but it has absolute potential to kill a living body or a human body. How? Because so this diagram basically shows that it's mainly present in the emission from the cars. Okay, it's also source from the ACs and the refrigerators. Okay, along with chlorofluorocarbon, we also have carbon monoxide eliminated from these equipments. Okay, so what exactly happens? Why is this carbon monoxide so much toxic to our body? We all know that inside our body we have RBC, which is a very important cell of our blood, and inside the RBC what we have is we have hemoglobin. Hemoglobin is basically the main component, you can say, of RBC. Okay, it's the functional unit of RBC. So what is the role of this hemoglobin? The role of this hemoglobin is to carry oxygen and reach that oxygen or transport that oxygen to the various cells and tissues of our body, so that the cells and tissues get their required amount of energy. Okay, so along with oxygen, hemoglobin also carries CO2. Now what happens if instead of this CO2, we all know from where CO2 is coming from, isn't it? We are inhaling oxygen and in turn we are exhaling the CO2 out from the body. So till that CO2 is exhaled out from the body, the one who is carrying that CO2 is the hemoglobin. So if instead of carbon dioxide, this carbon monoxide comes and binds with hemoglobin, then what will happen? Hemoglobin will no longer have the space to go and bind, or no longer have the appropriate structure that it needs to go and bind with the carbon dioxide and oxygen. As a result, what will happen? Oxygen and carbon dioxide will no longer be able to be carried or transported inside our body. As a result, our normal respiration, our normal metabolism, everything will be affected. Our body cells will not be getting the energy, and obviously that will lead to our death. Respiration or breathing is something which is absolutely necessary for our survival. If breathing or respiration stops in our body, then maximum we can live up to 4 to 5 seconds, not more than that. Okay, so we can understand that what amount of toxicity this carbon monoxide actually brings to our body. Okay, now there are different aspects of toxicity when we are talking about toxicity. Okay, so the first aspect will be the dosage, obviously, because depending on the dose, the level of toxicity, the amount of effect, the extent of the different side effects or adverse effects will also vary, isn't it? The second aspect will be the chemical or physical form of the substance, obviously whether it's a chemical agent, chemical reagent, or a physical agent. Third will be the mode of entry into the body. Obviously, say if a poison is given orally, or if that same poison is given intravenously or intramuscularly, the effect will vary, isn't it? The extent of toxicity will vary. Okay, so how the poison or how the toxic agent is entering inside the body of the person, of the suspect or the victim, will also dictate or rule the level of or the extent of toxicity. Next is body weight and physiological conditions of the victim, including age and sex. That is also very important. Okay, depending on the age, not only age and sex, but I would also say height and weight. These will also be some of the defining physical characteristics of the person as far as toxicity is concerned. Okay, say for example, if a person is 50 kg, is having a weight of 50 kg, and if another person is having a weight of 80 kg, then obviously for a drug to cause, for a drug or for a poison or for a chemical agent to cause toxicity in both the patients, the amount of the drug will vary, isn't it? If the 50 kg person needs, say for example, 1 milligram of the drug, then the 80 kg person will at least need 1.5 milligram of the drug, isn't it? So that is it. Next will be the time period of exposure, again a very important factor. The more the time period of exposure, the more will be the effect of the toxic agent. And next is the presence of other chemicals in the body or in the dose. That is also very important, whether the toxic agent is being given in combination with some other drug or medicine, or if there is already presence of some toxic agent or poison beforehand in the body of the patient or the person. Okay, these factors will also come under the various aspects of toxicity. Now coming to another important concept, that is lethal dose. Okay, so what is lethal dose? Lethal means fatality, or lethal means the lethal dose is basically the dose which will be able to kill that particular person or that particular living body. Okay, so it refers to the dose of a substance that kills half the test population, usually within 4 hours. Testing is usually done on animals that compare well to human metabolism. Okay, so basically whatever animal testing we are doing as part of research or as part of experiment, whether it's related to forensic toxicology or any other subject, we need to choose the animals which are very much genetically similar to the humans. Okay, and if the animal is genetically similar, then what will happen? The different metabolic processes, the different genetic makeup will also be similar. Okay, say for example, the different metabolic processes, the different biochemical processes, the process of excretion, respiration, all of this will be similar. So the identical animals that we can choose, they are usually the monkeys, the chimpanzees, or the apes. Okay, so what we see is the exact definition of lethal dose will be, it will be that particular dose of a toxic substance which will be able to kill half of the test population. So if say for example, if the test population is 10, then if the lethal dose is able to kill at least 5 of those monkeys or chimpanzees from the total number of 10, then that means that will be my lethal dose. Okay, and that too within a stipulated time, which is 4 hours. Okay, and this lethal dose, what is the unit? It is expressed in milligrams of substance per kilogram of body weight. Okay, means 1 milligram per 50 kilogram of body per kilogram of body weight. Means, say for example, if the body weight of the monkey is 30 kg, then if the lethal dose is 5 milligram, then I will write it as the lethal dose will be 5 milligram of the toxic substance. Say for example, arsenic is the toxic substance, so the lethal dose will be written as 5 milligram of arsenic per kilogram of 30 kg. Okay. Okay, now depending on this, toxicity, toxic level, different classifications can be there based on the level of the lethal dose. Okay, so say for example, these lethal dose, as you can see in this table, it is tasted in rat instead of monkey or ape, and it is given by the oral route. Okay, so if the organism, either of the organism or either of the mode of the entry is changed, it will also change the LD. It will also change the value of the lethal dose, obviously. Okay, so if it's less than 1 mg per kg, Then how will we correlate it with ingestion by a 150 lb adult human, an adult human whose weight is about 150 lb. 150 lb means how many kg? I think it will be around 72 or 75 kgs. Okay, so it will be a test to a drop, means only a drop will be sufficient to cause toxicity. Okay, and that toxicity will be extreme. Second is, if the lethal dose in the rat is 1 to 50 mg per kg, then we have to give at least a teaspoon of that particular toxic agent, and the toxicity produced will be high. Then if it is 50 to 500, then to an ounce we have to give, and the toxicity will be moderate. If it is 500 to 5000 mg per kg, then only to a pint. Toxicity will be slight. If it is 5 to 15 gram per kg, then to a quart. Toxicity will be practically non-toxic. Then see, more the lethal dose, less will be the toxicity of that substance, isn't it? Because more lethal dose means more amount is actually required to kill half of the population. So that means automatically the toxicity of that agent is decreased, isn't it? And if it is more than 15 gram per kg, then more than 1 quart we have to give, and even after that the toxicity, it will be relatively harmless, means it will be relatively a non-toxic agent to the human being. Okay, now there are symptoms of various types of poisoning. What are they? Number one, caustic poison, which is also known as lye. It will cause characteristic burns around the lips and mouth of the victim. Number two, we have carbon monoxide, something I have already talked about. It will be producing red or pink patches on the chest and thighs, usually bright red lividity will be there. Then we have sulfuric acid, which will lead to black vomit. Then we have HCl, that is hydrochloric acid, which is very much common acid, but it's the most highly concentrated acid after H2SO4 and nitric acid. Okay, so it will lead to greenish brown vomit. Then we have cyanide, which is again very much fatal. It leads to death within few seconds. So it will lead to seizures and also burnt almond odor. And arsenic will lead to diarrhea, vomiting, blood in the urine, cramping muscles, stomach pain, and convulsions. And number 7 will be methyl or isopropyl alcohol, which will be causing nausea and vomiting, unconsciousness, and possibly also blindness. Okay, now if we have to prove a case based on forensic toxicology, then what are the things that we need to take care of? Okay, so first will be the motive. Okay, so based on the study of that toxic agent or poison, we need to find out what can be the motive of the criminal. Second, what is the intent of the criminal? Okay, third is access to poison, from where the criminal might have got that poison from. That will also depend on what type of poison it is, because all different types of poisons or toxic agents are not available in the market for public access. Okay, next is access to victim. Okay, means how, after collecting the poison, after getting access to the poison, how the criminal actually reached the victim, that also needs to be considered. Whether the death was homicidal or suicidal, that needs to be considered, and whether the death was actually caused by the poison or maybe due to some other reason. So these are the different points that we need to keep in mind as forensic pathologists. Okay, now there are different toxicological techniques. Okay, let's see. So 90% of drugs analyzed is for alcohol and cocaine. The toxicologist must devise an analytical scheme that will successfully detect, isolate, and specifically identify a toxin. Large number of drugs will either be acidic or alkaline in nature. So by controlling the pH of a water solution into which blood, urine, or tissues are dissolved, the toxicologist can control the type of drug that will be recovered. So if we can actually control the pH or regulate the pH, then we can actually find out whether the drug was actually acidic or alkaline. Okay. So talking about the acidic drugs, so the acidic drugs are extracted from an acidic water solution with organic solvents such as chloroform. And what will be those drugs which can be mainly extracted? It will include barbiturates, and it will include acetyl salicylic acid, which is nothing but aspirin. We all know the role of aspirin. Okay, and barbiturates are mainly different cough syrups which can be used as good poisons and good, abusive drugs. And besides cough syrup, this is also mainly find in the sedatives. Okay, the different sleeping pills, it's used as neuro calming drugs also. Okay, and aspirin is obviously a painkiller, as we all know. And talking about the basic drugs, those are extracted from an alkaline water solution with different organic solvents. So they will include phenylcyclidine, methadone, amphetamines, and cocaine. Okay, all these are basically neuropsychiatric drugs, psychotropic drugs basically. Okay, they will lead to hallucination. Okay, lead to typical feeling of highness. Okay, not living in the reality like that. Okay. Okay, so basically this is a nice flow chart that I have given to make you understand the main concept of these drug testing and all as far as forensic toxicology is concerned. So say for example, this is the sample that I have obtained from the crime scenario, and then we need to extract the sample by maintaining the appropriate pH. So if we see, so after extracting, it can actually be an acidic drug or it can be an basic drug. Okay, so what we need to do, we need to go for screening test. So under screening test, different tests or assays come in, as you can see over here. So there will be there can be immunoassay, there can be gas chromatography, and there can be TLC, that is thin layer chromatography. And finally the confirmation test will be gas chromatography along with mass spectrometry, which is also known as GCMS. Okay. Okay, now talking about some heavy metal poisons that we have, which are actually very much rarely encountered. And among the heavy metal, the first important toxic metalloid that will come will be arsenic, as I already talked about before. After that, we have bismuth, we have antimony, we have mercury, and we have thallium. All these will come under toxic heavy metals. So they will be extracted into HCl solution, then a copper strip will be inserted, and this particular test is known as Renz test. So if it's positive, then a particular color will be developed, which is silvery or dark color coating on the copper. On that copper strip, we will observe this particular silvery or dark color. And then it will be confirmed by different gas chromatography or spectroscopic techniques like atomic absorption spectroscopy, spectrophotometry, which is also abbreviated as AAS. Then we can also go for emission spectroscopy or X-ray diffraction. Okay. Uh, and talking about a bit again about carbon monoxide, which I've already talked about in the earlier slide also. So it's a very commonly encountered poison in the different crime scenarios as far as forensic investigation or forensic toxicology is concerned. So basically we all know, as I mentioned earlier also, that this CO will go and bind with hemoglobin and no longer allow the hemoglobin to go and bind with normal CO2 and oxygen. Okay, and as a result of this binding, as a result of this abnormal binding between CO and hemoglobin, what we will get something called carboxyhemoglobin instead of oxyhemoglobin. Okay, so now there are different methods of determining this level of carboxyhemoglobin or CO in the blood. So there will be different spectrophotometric methods which will be examining blood's visible spectrum to determine the relative amount of carboxyhemoglobin to oxyhemoglobin or total hemoglobin. Means how much the level of total hemoglobin is there in the body compared to how much of carboxyhemoglobin has actually generated in the body. So we will be getting a nice ratio, so we can compare the level of toxicity. Okay, and also another thing that we can do is we can go for gas chromatography, okay, instead of spectrophotometry. So where we will be using a particular reagent which will be liberating the CO, and then that CO will be measured in terms of percent saturation. So if the percent saturation is more than 60% or even between the range of 50 to 60%, so that means it's a fatal condition, that person will die. Okay, so I think that's it for the first session of this topic. Soon we will be moving on to the second session of this topic of toxicology. Till then, thank you and goodbye. Please like, share and subscribe ITLS Academy. Thank you.